This is the second part of the talk that we started last week. Today we'll be talking about the examination of a new glaucoma patient. So if you go on to the first slide, on the left hand side is the history side where we went through last week. On the right hand side is the examination side. And if you remember from last week, we talked about the first 20 seconds when the patient first comes through, even before you ask them. The first 20 seconds you look at them. This is actually the start of your examination. Then you talk to the patient, and now we're examining the patient. Now, if you've got a glaucoma nurse that's helping you in the clinic, then obviously they will be taking the visual acuity for you. They may even have taken the RAPD for you and done the color vision. What's important to remember is that when we have nurses that help us who are very good at collecting these data, that we don't forget to look at them, because I have found that some doctors actually forget to look at them and completely ignore the vision and not realize that the vision has dropped from since they were last seen by somebody else. Have you come across that, Graham?
Well, yeah, the visual acuity is such an important thing, and it seems so basic, and the nurses just do it routinely, and some of them don't even think about it, and that can be a problem. Like, yeah, not so much for glaucoma patients, but sometimes when you've done a cataract operation and they test the patient's vision with their old glasses on, and they just get terrible visual acuities, and it's because they're wearing their old glasses on top of their new intraocular lens. So that can be a bit frustrating. I noticed you like to get an unaided visual acuity, and that can be important, especially if I'm doing refractive surgery. You want to know what their unaided visual acuity is like, and oftentimes they got very high refractive error. Obviously their unaided visual acuity is terrible. Especially if they're -5 myope, they're not going to be seeing anything on the chart really. I suppose that's not as important for glaucoma patients so much, what their unaided acuity is. You really want to know what their best refractive correction is in terms of the spectacle corrected visual acuity. Obviously glasses don't always provide the best spectacle corrected visual acuity, especially some patients. You ask them how long have they had their glasses, and they say, oh, about 10 years. And you know that possibly it could actually be improved. And that's when I have the benefit of an optometrist who can do a refraction and get the best spectacle corrected visual acuity at the time.
If you enjoyed this lecture so far, please subscribe to http://iop.vision. I hope you enjoyed this series as much as we have putting it together. Thank you.